Welcome to Group 15, where we'll be discussing the importance of using medical imaging to assess bone strength. The human body has on average 206 bones. Whilst their main function is to provide the body's structure, they also play a pivotal role in protecting organs and anchoring muscles. Having strong bones is important for minimizing the occurrences of fractures. Certain medical imaging techniques are able to scan for potentially weak bones susceptible of fracturing. Whilst it is essential to have healthy, strong bones, adopting medical imaging techniques to assess bone strength is controversial, which we'll be discussing further on. In a growing individual, bones are constantly being broken down and rebuilt, a process called restoration. Bones can fracture and lose their strength by a large traumatic force alone. Estimating the force required to fracture a bone is difficult, and some of this has to do with the muscle and tissue that surrounds the bone that absorbs the impact of a traumatic force. It is estimated that a force of approximately 4,000 newtons has a 1 in 4 chance to break an adult femur, the strongest bone in the body. Now, since a large component of bone strength is calcium, a diet that lacks in calcium usually leads to brittle bones. However, both physical exercise and resistant training can increase bone strength. So far we've discussed how bones fracture by force alone, but what happens when bones just lose their strength due to old age? Bones reach a peak density at about age 30, then the bone mineral density begins to decline when the reabsorption of bone occurs faster than bone formation. Ultimately, this can lead to a condition called osteoporosis, meaning porous bone. In this state, bones can fracture very easily, a condition that can result in sudden fractures affecting approximately 4.7 million Australians per year. Of this 4.7 million, an estimated 144,000 associated fractures have been documented. It is estimated that without early diagnosis or an implementable management plan, the rate of osteoporotic fractures will increase by 30% by 2022, which is estimated to cost $33.6 billion in medical expenses to the nation. Bone mass reduction increases significantly after the age of 55. The rate of bone mass reduction is greater in women, especially after menopause. Osteoporosis is highly problematic because more often than not, symptoms are not detected prior to the first initial bone fracture, as the loss of bone occurs silently and progressively. Recent advancements in digital imaging technology have provided a non-invasive method of scanning for weak bones in an individual. If detected early, there is the possibility of rendering treatment to minimize fracture occurrences. A bone mineral density test is the standardized testing method of bone strength in Australia. Bone mineral density is acquired by scanning the axial skeleton by dual energy X-ray absorptiometry, or DEXA for short. The aim of scanning for bone strength is to 1. Recognize significant signs and patterns of bone loss, 2. Accurately predict individual fracture risk, and 3. Adopting an appropriate treatment plan. Dual energy X-ray absorptiometry measures bone, muscle, and body fat present in the region scanned. The densitometer utilizes two thin beams of low-dose X-rays with distinct energy peaks. These are absorbed by bone and soft tissue, allowing for the calculation of bone mineral content. This content is divided by the bone area scanned to calculate bone mineral density. All tests compare bone mineral density against that of a normal 30-year-old adult to give a T-score. The T-score is a measure of the number of standard deviations of bone mineral density, either above or below the peak bone mineral density standard. The World Health Organization have defined a score of less than 2.5 at the spine or hip as having weak bones due to osteoporosis. We'll now look at a clinical study. We have Zara, a 60-year-old female with low body weight, poor diet, and mother of two, who's fractured her hip following a fall. We'll refer her for immediate DEXA analysis of her hip and spine. The results are as follows. Zara has a T-score of -2.8 at the hip and -2.2 at the spine. Recommended treating with osteoporosis medication and administer calcium and vitamin D supplements with a strong exercise regime. Assessing bone scans has benefits in prevention of injury and fractures, not only for sufferers of osteoporosis, but may also be applied for persons in response to treatment of drugs, bone growth development in children, and prevention and recovery from sports and physical exercise. Whilst there are some major positives for scanning for bone strength, is it actually worth scanning the entire population? Most men under the age of 70 and women under the age of 65 do not suffer from bone loss, and often in cases where osteoporosis is evident, this can be treated by diet and exercise alone. There is also the undesired application of X-ray radiation for patients that must be considered. Furthermore, drug treatments for bone loss are heavily reliant on medications such as Fosmax and Actonel, which have undesired side effects such as blood clots, stroke, and serious infections. Finally, DEXA bone scans, although deemed the standardized method of screening, is still not 100% reliable, with the scan having a sensitivity of approximately 98% and specificity of approximately 93%. Assessing bone strength has the potential to improve the quality of life by diagnosing premeditated bone fractures for those with severe bone loss and decreased bone strength. Osteoporosis is a highly prevalent disease which displays minimal symptoms, and associated fractures lead to patients with limited ambulation, loss of independence, and decreased life quality from chronic pain, disability, and extreme loss of mobility. However, bone fractures resulting from decreased bone mass occurs mainly in an older population only. We suggest that bone scans be made readily available for patients over the age of 55, where bone density starts to decline rapidly. Furthermore, younger individuals should only be targeted for scans if there is a family history of the disease and associated fractures to avoid unnecessary radiation exposure.